You're listening to the WHO podcast. My name is Ravini Tenabadu and this is episode 37. In this episode, world leaders call for action to reduce tuberculosis deaths among people living with HIV. Nearly 250,000 people living with HIV die from tuberculosis every year. This is despite the fact that TB can be treated. Heads of governments and UN agencies, public health and business leaders, as well as activists came together recently in New York to discuss this emerging threat to global health. The conference, called the HIV-TB Global Leaders Forum, was convened to focus on the actions required to drastically reduce the number of deaths from HIV-related TB. At the conference, we asked 2 delegates to share their thoughts on the next steps. Nicola Brennan, a senior advisor with the Irish government, said her country will support the call for action issued at the meeting.
I think this meeting has brought a lot of heads together and there's emerging consensus on what is actually required. So I think the thinking is advanced and practice is advancing at country level, but that needs a lot more support and intervention, and there are a lot of issues yet to be dealt with that have been raised, and I think a few of the gaps were around the call for action which is coming out of this meeting, which our government will support, does need to be more explicit on addressing TB and HIV in children and in women.
For Nigerian health journalist Olayide Akani, there was a clear message on the role of activists.
We as civil society are doing is even to get more civil society groups on board on TB, because one of the challenges is that there are a lot of NGOs working on HIV and AIDS, but very few speaking on TB issues. And I think that we need to also mobilize at country level to get more civil society groups, talking the same issues, who are already working on HIV, also integrating TB and advocating that the government can do a lot more.